Good afternoon. My name is Kasha. I'm a pediatric pulmonary fellow, and today I'll be discussing my poster, What Do You Call Your Inhaler? A Family Survey About Asthma Inhalers in Both a Primary Care and Pulmonary Subspecialty Clinic. As far as for some background, written asthma action plans have been around intended to improve medication adherence and improve asthma outcomes, but are only effective if they're understood by families. And studies have shown both in an adult as well as caregivers of children, those with low health literacy have increased asthma exacerbations and ED visits, and partly because of inhaler confusion, which can be a common cause of medication non-adherence. Therefore, the objective of this study was to identify terms that families use for asthma inhalers and whether they understand how medications work in both a primary care setting as well as a pediatric pulmonary subspecialty clinic. And so we hypothesized that families of children with asthma would identify terms for the inhalers that are not currently used on asthma action plans. And in addition, families from the pulmonary clinic would have greater understanding of mechanism of action of their medicines. And so this was a cross-sectional convenience sample over a 6-month period where parents or caregivers of children were approached of children with self-reported asthma, both in a urban primary care setting as well as a pediatric pulmonary subspecialty clinic. There are 22 survey questions in addition to the newest vital sign, which is a survey of assessing health literacy. And it was completed in the primary language of the caregiver's choice. And asthma inhalers were identified on a picture poster with most common rescue and controller inhalers. And once identified, the participants were asked to state what they called that medication when they used it, as well as identifying mechanism of action. And as you can see in the socio-demographic characteristics, primarily the age range of those taking the survey was between 25 to 45 in both the pulmonary and primary care clinics. As far as the ages of children with asthma, they were much younger in the pulmonary versus the primary care clinics. Both preferred English language, and primarily both had Medicaid insurance, as well as the ethnicity was Latino Puerto Rican, although followed closely by non-Latino white in the pulmonary clinic versus primary care. In the pulmonary clinic, we noted that the education was college or higher, which was much more prevalent versus only high school in primary care setting. And finally, the overall health literacy was noted to be in the adequate range, close to 50% in the pulmonary clinic, versus most likely to be limited in the primary care setting. As you can see in our results, both in the pulmonary and primary care setting, most caregivers identified their rescue inhalers by pump or pompa, whereas their controllers by the brand name, followed by pump or pompa. And as far as having heard of rescue or controller, those in the pulmonary clinic were more likely to have heard of rescue and controller before versus those in the primary care setting. As far as relationship between health literacy and having heard of controller, those with limited health literacy were less likely to have heard of controller before versus having adequate health literacy. But even those with adequate health literacy in the primary care setting, they were less likely to have heard of controller medicines before. And finally, understanding mechanisms of action of both rescue and controller was much less so in the primary care setting versus pulmonary, especially when it came to controller medicines, both for pulmonary and primary care setting. Therefore, from our results, we noted that most families call their rescue inhalers by pump or pompa, whereas they refer to their controller medicines by their brand name. The majority, even though they recognize rescue, primary care participants were less likely to have heard of the term controller medicines. The population also that we've studied was not familiar with mechanisms of action of their inhalers, regardless of healthcare setting. And to improve asthma action plans tailored to health literacy level and preferred medication names, along with education related to medication of mechanism of action, these all may improve adherence, resulting in better asthma control. Thank you.